Thank you, Joe. So we're going to move from the classroom setting to the community. Our next speaker is Chris Economos from Tufts University, who has developed a very successful model of community engagement, and she's going to share some of her experience and talk about implementation.
Good afternoon, everyone. I know it's getting late in the day and people are probably starting to fade a little bit, so I'm not very data heavy with my slides. I have a lot of photos like Matt did, so hopefully you'll also be inspired by some of the story I have to tell you. I want to thank Art and the team here. It's really nice to be here. It's my first time on the campus, and so I will go out and walk in the rain and get to see some of it. So what I'll do in a short period of time is share some of my thinking and how it's evolved over the past 15 years in trying to catalyze large change within communities and really scale up evidence-based interventions. So the first thing I want to talk about is some work that I did over a decade ago that Russ Pate was involved in, looking at other models of social change in America and trying to extract some key learnings that we could apply to the work we all do in physical activity and nutrition and trying to prevent the obesity epidemic and related diseases. And you probably all know that we've had some significant social movements in the United States. It doesn't mean there isn't still work to do, but I think about my childhood where people around me smoked a lot. I remember buying cigarettes for some adults. I didn't recycle in my home, didn't wear seatbelts, and I was breastfed, but I think most of my peers were not. So that's back in the early 60s. Very different right now. So we've accomplished a lot with these social movements and big public health change. So how are they successful? What can we learn, and how could we apply that to some of the work that we do? Because although many of us in the room who are evidence generators do small controlled trials and laboratories, the real goal is to take that evidence and scale it up and create social change and really catalyze a cultural shift. So I'll share the 10 key learnings that were common to all of these social movements. And for those of you who've studied sociology, they'll look pretty familiar to you. And then I'll talk about how I've applied them to my own work in obesity prevention. So all of these movements had the call for a crisis, and we definitely have that right now. You can't open a newspaper without reading about the obesity epidemic, inactivity, poor diet, et cetera. So we clearly have a crisis, and we have some economic modeling now that shows us both healthcare costs, military readiness, et cetera, is really in jeopardy. We have a pretty good sound scientific base, as did these social movements, so that we could take action. We're here sharing evidence. We're a network of individuals exchanging information, I think getting excited about how we can go back and apply these to our work. We're at a pretty good place right now with the evidence base. Still work to do, and that's been noted throughout the day, but we're a lot further along than we were a decade ago, particularly with evidence in the built environment as a result of the Active Living Research Initiative funded by RWJ and the work of many others. Spark plugs, absolutely key to anything. I've heard everyone in their talks talk about that teacher, that principal, that researcher that wouldn't stop. Matt, how you've looked at your career, taking some risks, really big and bold, and thinking outside the box, and really trying to lead the charge. Spark plugs exist at every single level, and they were all present in these movements. The importance of economics. I think we're catching up now beyond healthcare modeling costs. We're doing a lot of other economic modeling. I'm personally doing return on investment modeling with colleagues at the CDC and other health economists to try to understand the cost effectiveness of my interventions. What are the calories burned for the money I'm putting in? Developing coalitions and advocacy, they all had these. We all are part of these, and it has to be bottom up as well as top down, no question. It's real people on the ground to do this work, despite high-level recommendations that many of us spend time making. Using government strategically, that's local, state, and federal, all has to be part of it. Employing mass communication. We have some pretty good examples now of mass communication in the area of physical activity and nutrition. Clearly, the First Lady has the Let's Move initiative and many other sub-initiatives that have come out of that. There was the Verb campaign. We need to do better and really compete with marketing, and the slide that was shown by Deanna on nutrition education versus the amount of marketing and messaging that kids get from the private sector, which isn't always promoting health. Creating environmental and policy changes, a lot of what most of us spend our time doing, trying to really move the landscape toward healthier defaults. And lastly, developing a clear plan. So extracting these key learnings from these other social movements, and this paper resulted from looking at policy documents, peer-reviewed literature, and interviewing over 50 key informants who'd spent their careers working in tobacco or seatbelts or recycling. And it was a tremendous amount of work that helped me understand what I needed to do with my own work to make some large change. So I applied this to a grant called Shape Up Somerville about a decade ago. This was funded primarily by the Centers for Disease Control. And it was really one of the first community-based participatory environmental approaches to prevent childhood obesity. It was a 3-year controlled trial. We focused on early elementary school children in one diverse community right outside Boston with 2 controls that were socio-demographically matched. And these are the goals I wrote in the original grant. And I like to tell the story that people laughed at me when I submitted this grant because it seemed kind of bold to examine the effectiveness of this big, ambitious model on the prevention of undesirable weight gain in children, and I'm glad someone showed the expected weight gain through the ages. In a 1st through 3rd grader, you'd expect to see about 6 pounds or so per year. You don't want to see 10 to 15. So it's preventing the undesirable weight. And the second one is why people really laughed. I wanted to transform a community and inform social change at the national level by using what I had seen. It doesn't seem funny now, but it did in 2001. But we were pretty successful, and I'm proud that Somerville really has served as an example, along with many other communities that have tried to do this transformational work. So this is really the model of what we did. I won't spend a lot of time on it, but this is before the Wang calculations of approximately 150 calories representing the energy gap. I did my own that were not quite as sophisticated, and I came up with 125, so not bad. So I designed this intervention to address an energy gap of about 125 calories. So you'll see calories sprinkled here throughout the day. But my approach was similar to what they put out recently in educating the student body. Where do children spend their time, and where are the opportunities to intervene with evidence-based strategies? So I used the evidence that existed, and I really put them together in a package or a portfolio of interventions and plunked them into this one community. Spent an entire year assessing the readiness and building capacity, which is a whole other talk, and then started in year 2 with the actual intervention. So what I want to highlight is before school, you can walk to school, and we developed a Safe Routes to School program. You can get to school early and participate in the breakfast program, and you can sit for 45 minutes, or you can get someone in the school to get you up and moving, et cetera. So we tackled that in the morning with both nutrition and physical activity. During the day, we tried to increase the quality of time kids spent during recess, so they were up and moving. We did classroom micro-units with a curriculum that we have published now and is available, where the teachers were doing physical activity in the classroom. And we did a tremendous amount of professional development and tried to increase the quality of the PE, which was 1 to 2 days a week in these communities. After school, we did a second curriculum for all of the after-school programs in the community focused on physical activity and increasing the time and the quality of it. We had a walking home program, Safe Routes Home from school, and then we had a lot of activities in our reinforcing environments, which with the home environment, as Diane noted, incredibly difficult to tackle, but we made some progress there. And then the community at large. And I could spend a lot of time telling you about some of the transformations that happened to the built environment in the community. Initially, they were low cost, no cost, like making streets one way for a portion of the day, shutting them down, thermoplastic crosswalks instead of paint, speed bumps, bike racks, things like that. Now the community has gone on to secure federal and state funds, and they've actually done quite a bit of construction, extending the bike path and things like that. But it became a more viable, walkable, bikeable community. So overall, there were a lot of efforts using the evidence base, a lot of what you said, Joe, kind of using every opportunity throughout the day, particularly the school day, to increase physical activity and get children closer to the 60 minutes per day, and now the recommended 30 minutes during the school day. So we did intervene in the home with the parent, child, and family, and here's a walking school bus. We intervened in the school with the children, the teachers, the administration, and the staff. And here's a photo of before and after, I'm sorry, this is just after what school lunch looked like. We have a separate paper on this, but as in many communities, it was initially boxes and cans and processed food, and we transformed it to actually whole foods. We worked in the community with all 14 after-school programs, all the ethnic minority groups, and the restaurants, and started an initiative there to decrease portion sizes, have signage, serve water, a lot of things that are happening now, labeling, which will be part of the nation now with the Affordable Care Act. And I want to note with the ethnic groups, it turned into a separate R01 after this study was over, because this is a community with a lot of immigrants, Brazilian, Haitian, and Latino families, and focusing on them in this intervention really helped me understand the different types of strategies that would be needed to reach them. So I just completed another RCT with immigrant populations in this community and learned quite a bit. This is one of the after-school programs incorporating some different physical activity. This is the mayor eating at one of the Shape Up approved restaurants. Oops. This is one of the community events where those little art projects had been created with fruits and vegetables. And then we worked with the healthcare system. We trained every pediatrician, family physician, and their nursing staff in the community to actually properly screen and refer for overweight and obesity, and also to incorporate the same messages that we were incorporating in. And they became very involved and actually started a road race, which goes on till today. We worked extensively with local government, primarily on policy change that would be sustained, and I'm happy to say it's not only been sustained, but it's been expanded, and the community is in much better shape now. And this is a walkability built environment meeting that we had during the intervention. And then we worked with local media. And to show you what the results were, primary outcome was BMI Z-score. And what you're looking at here are the 4 time points where we measured the children in the 3 communities, before and after 2 different school years. And focus on the line that represents the intervention line, the second one down with the diamonds, compared to the line under it, which is the combined controls. A priori, the design was to have 2 controls in case one became contaminated with another intervention, hard to stop real-world activities from happening. And so the plan was to do the comparison with the combined controls. We did, of course, do it separately as well, but the results I'll show you here are versus the combined controls. So during the first year of the intervention, the BMI Z-score went down in Somerville compared to the 2 control communities. And in the second year of the intervention, it went down. But you'll notice that unfortunate increase in the middle, which is the summertime. And so in low-income communities across America, when school ends, for a lot of parents, particularly underserved, childcare ends. We did a separate study as a follow-up, and I can tell you these kids were inside most of the day, watching television, playing video games, and eating. And so we had kids come back from both intervention and control with a weight gain of up to 10 pounds over the summer. So this is a real area of concern. Many people are now starting to work on it, but I think we are undoing a lot during the summer that we work hard to accomplish during the year, far beyond obesity, but related to literacy and fitness levels. So there are studies you can find out there that are showing the same thing for those variables as well. So we need to get control of the summer, and some communities have gone to year-round schooling, or kids who are in summer school do better, actually. They're protected from grazing all day because they're also forced to eat at times during the day, which is what happens during the school year. It actually provides some discipline with eating. So there are lots of protective factors that come with school. So these are the 2 papers we've published, significant difference in the intervention versus control schools and BMI Z-score, where there was a decrease over the first year as well as the overall 2 years. We just published this month some of the behavioral data, and I'll just point out the 3 areas where we saw a significant change in behavior: a decrease in sugar-sweetened beverage consumption, an increase in sports and activities, and a decrease in total screen time. So these are some of the behavioral variables that drove the change in BMI Z-score. I want to talk for a moment about my thinking now, because when I completed that trial, it was so messy and there were so many things going on. When I presented it in a linear way, it felt very ineffective to me. So I started to work with some system scientists to help me understand what had actually happened in that community. And using a systems-oriented approach helps you look at the whole system. And since obesity is such a complex issue, or even physical activity on its own, we need complex methodologies to really address them. So I won't spend time on this, but it just really is the background as to why I've gone into using system science. And I've used dynamic mapping, I've used agent-based modeling, et cetera. This is systems thinking. It's not linear, it's not even multi-level, but it really is interconnected. So what I did in Somerville was I did a retrospective analysis of what had actually happened in that community. When the paper was first published, I got calls from all over the country, people saying, how do I do this in my community? Sending them a list or a linear representation of what happened really felt dishonest because it was a lot more complicated than that. There were multiple systems at play, interacting positively and negatively with feedback loops and time delays and all the things that happen when you work in the real world. And I wanted to explain to people that it wasn't just take my list and go find the right people to implement it. It was actually the human capacity and connections and relationships that made it work. So I went on this journey to actually try to map what happened in Somerville, and this paper is not published yet. It will hopefully be published soon, but it is a retrospective examination. It's quite qualitative, but what I want to illustrate for you is the multiple systems at play in any community or in the nation at large when you're trying to do this work. So just to highlight, I thought that was a laser pointer, I'm sorry. Big circle in the middle. This is the individual, which is really what we often think of as at the center of the socio-ecological model with multiple layers around them. And this individual has an energy balance loop, as we all do, energy in, energy out, and if it's in balance, you're maintaining your weight, and you know how it goes. And what impacts that are all these systems in a community, the built environment, the food environment, the media, an actual coalition of people, in this case called the task force, the school environment, the family unit, and the community at large. And so this map really illustrates how complex it was, and the paper and the narrative that accompanies this really tells the story of how it actually happened. And it's not to discourage people and have them look at it and say, I could never do this, but it's to tell the truth. It really does take a tremendous amount of capacity and time and leadership and all the things that I showed you in that first slide to really create social change at the local level. So I'll look forward to sharing all of this with all of you when it is ultimately published. So what I want to do in the next couple of minutes is just tell you about my current work. It's a large initiative called Child Obesity 180, where I'm trying to scale up nationally. So it's great to do that in one community and publish the work and inform others at conferences, et cetera. But what I really wanted to do was try to reach more kids in America. So along with a few key partners at Tufts, I've designed this project, which really, like all of us want to, tries to reverse the trend. And the unique thing about this is it engages high-level leadership across sectors, and those folks are from government, non-for-profit academia, and industry. And it's a group of about 20 CEO-level individuals who've been working with me for the past couple of years, trying to blend the evidence base with innovative approaches from the private sector. Because we do sometimes a good job in public health scaling up our work, and sometimes it doesn't really compete with what the private sector can do. So I'm trying to blend the innovation that the private sector uses, whether it's the VC model or many other innovative strategies that are being used now that are hard for us to compete with to scale up evidence-based strategies. And so we have a number of things going on, and today I want to share with you the Active Schools Acceleration Project, which is designed to increase quality physical activity in schools. And I also want to share that underneath all these initiatives, I'm applying some different methodologies like return on investment, systems modeling, and collective impact, which Bill alluded to really try to rigorously evaluate everything that I'm doing to make sure it does get published in peer-reviewed journals, but also to convince myself that the scalability is worth it. So the Active Schools Acceleration Project is really designed to increase quality physical activity as a means to combat obesity and to evoke all the other benefits that we've been talking about today, and to really accelerate the movement. So we have a 4-phase approach: identification, replication, scale, and sustainability. We're at phase 2. And what we initially did was we had an innovation competition. So about a year and a half ago, we put out a call across the country and said, tell us what you're doing in schools. Show us your innovation, how it's working. And if you're doing a really good job, we'd love to help you scale it up. We got 500 entries. We picked 9 winners. And now we're scaling up 3 of them across the country. And we really tried to celebrate all these winners, and we've become part of Let's Move Active Schools, so we're working with 9 other national organizations that are trying to increase physical activity in schools through policy and practice. So these are just some fresh approaches that we identified. This is a school in Colorado, Red Hawk Elementary, where throughout the day, every student accumulates 60 minutes of physical activity. Incredible principal at that school, redesigned so that it was activity friendly. In Harlem, the Just Move program helps kids get up and move throughout the day in the classroom, small spaces. The Box program, which started in Massachusetts, gets kids to school before the day, moderate to vigorous physical activity for about 30 minutes. Corona, California started the 100-mile club, where every child in the school, whether they walk, run, or wheel, completes 100 miles or more over the course of the school year. Incredible innovation going on out there. You call for it, it comes back. And lastly, at a school in the LA School District, Overland, this mom decided the whole school is going to do physical activity together every day, and she leads them through it. It's pretty incredible to watch. So we decided we would raise some money. We raised $1 million, and we were going to give $1,000 to 1,000 schools to scale up at least 3 of these this first year and see what happened with a rigorous evaluation. So we had a call for a second round, and we gave away actually 1,002 grants in all 50 states. So 1,000 schools have $1,000 right now. They're on their way. And the market told us what they wanted. We gave them a choice. The majority wanted the 100-mile club. Second to that was Just Move. And lastly was the Box program. And interestingly, the first 2 serve all the children in the school, and the second one is a select group that signs up and comes before school. So the truth is, those are serving more children. And I also wanted you to see who are the champions, because to apply to get the money, you had to be a spark plug with principal support and say, give me the money, I'm your spark plug, give me the program, and I'm going to implement it. And the majority actually were PE teachers, because as we know, PE's been cut. They're the first ones to say, this is not good for kids. I want them to be more active. Give me an opportunity to get them more active, and I'll lead that in the school. Followed by administrators, teachers, parents, nurses. The other thing I'll share with you is over 60% had a history of physical activity. High school athlete, collegiate athlete, coach, something. They were the people who believe. So we're evaluating this in a number of ways. One, through a survey, baseline, mid, and post, all 1,000. Last week, we released the survey for the baseline, and we have 550 completed already. These are people who are really willing to participate. The other thing we're doing, like Matt, I just got a score in an NIH grant, which missed by 1 percentile, so turned the multi-million-dollar study into a smaller study, but determined to get some good outcomes here. So we are doing about 500 kids with accelerometry over the course of this year to try to determine how much physical activity they're getting. We'll also get height and weight and school-level achievement scores. So trying to salvage a pretty rigorous study design and get some information out of it. So more to come on this, but I wanted you to certainly know what we were doing. And our goal is really to learn a lot this year and then scale it up beyond, not just with these 3 programs, but other programs that are in the incubator right now. And this is the website at Tufts if you're interested in more. Thank you very much.